But what I want to do right now, because I think that I have somebody who can talk much better as to why we need healthcare for all. Susan Blevin is a ESSN CareWorks member, activist and organizer, along with her husband Lee, although she is his better half, most definitely. So there you go. So Susan is going to take and share with you her story. And here you go, Susan.
Hi, I hope you can hear me. I have a very soft voice. It's good? All right, thanks. I'm Susan Blevin, and I've been asked to speak to you by ESSN CareWorks of Lane County on the necessity for true health care for all. I was asked to speak because of my personal experiences. I have over 20 chronic conditions and have had 5 major surgeries in the last 8 years. So I know the need for health care. Health care is a basic human right, and it's preposterous, outrageous, barbaric, or choose your own adjective, that the richest country in the world denies this human right to millions of its own citizens. I could have been one of them. I was a mental health therapist, and like most professionals, I had excellent employer-provided health care. My husband did not have health insurance. He was strong and healthy and never sick, so he never saw the need. Then he became disabled and lost his job. He had never thought about needing health coverage, and suddenly he needed it badly. That was strike one. We lost most of our income, and we were hanging on, barely. Then I became ill and could not work at full capacity. I lost my job and my health insurance. We went from making over $100,000 a year to living on one person's, my unemployment. We spent all of our savings on health care, eventually filing medical bankruptcy. In the process, we lost our home. Since I had worked with people who are on the Oregon Health Plan, I was well aware of that single-payer system. OHP worked well for my clients, although the system could be difficult to navigate and difficult to get on for adults. It took me a couple of years to finally get Social Security disability and start getting Medicare. We were barely able to keep our heads above water. Fortunately, we had family to help. We were fortunate. We had friends and family willing to share their homes, so we were never in danger of homelessness like so many people. Still, we had to leave Beaverton for the coast to find affordable housing and a case manager willing to do the hard work necessary to get me on OHP as a single-payer insurance. Exactly what we all need. After more than
No.
See what happens. See what happens.
I'm doing well.
See what happens when your husband helps. It's not working.
It's,
Yes.
Here it is. See what happens when your husband helps? After more than 2 years of trying and fighting, I got my Social Security disability and was enrolled in Medicare, a federal program that almost all Americans will eventually participate in. The timing was perfect. Soon after obtaining Medicare, I had 3 surgeries to remove a tumor. 2 of them were for complications of the first. I was hospitalized for more than 4 months in total and about 9 months medical rehab. Who can afford that? Even if you've got insurance, it's not going to pay for all that. Despite concerns of socialism, single-paid health care is entrenched in American society. OHP, Medicare, and VA benefits are examples. Why is it so difficult to move past these splintered specialty programs to ensure that all Americans have high quality health care? Despite having the most expensive healthcare system in the industrialized countries, we were last in their care rankings, and in 2018, the last data I have, we ranked 37 overall of all countries. We're even after Costa Rica. I have spent more than 2 years in hospitals and long-term care, medical care. My medications alone cost more than $4,000 a month, and that does not include doctors, procedures, and other care that I need. Who amongst us can afford these costs, or even the deductibles and co-pays? Without universal single-pay coinsurance, I would be dead, and there's many, many more out there who are like me. Many people die or endure ill health without adequate health insurance. It's not just older people that need this. Accidents and illness can I'm sorry. I get a little emotional. Accidents and illness can strike anyone, no matter their age, race, or income. Many young people live without health insurance because they can't afford it or feel they're immortal and don't need it. They are one illness or accident away from disaster. I know a man who needs knee replacement because his insurance has a $5,000 deductible and a 20% copay. He must suffer pain and disability because he can't afford the procedures that would alleviate his pain, and he doesn't qualify for any government program. Other states and cities have attempted to provide universal, often single-pay health care for its citizens. San Francisco was the first in 2007. Anyone who resides in its borders can receive sliding scale or free medical care. New York City has its own version of universal health care that was to extend to all boroughs by this year. Vermont attempted to implement single-pay universal health care, but it couldn't absorb the costs without strategies that the federal government doesn't allow. Currently, over 20 states are working on implementing universal and/or single-pay health care, including Oregon, California, and Washington. Universal health care, however paid for, is an idea whose time has come. The federal government has been too polarized to implement this very basic human right, although we have wonderful people who are attempting to do so. It is time for Oregon to lead the way in meeting the needs of its citizens. Health care for all.
Deal.